Well, hello everyone, and welcome to this episode of Alliance Live. Today we're going to be exploring the new law in Scotland that makes changes to organ and tissue donation. I'm Lucy Mulvey, the Alliance's Director of Policy and Communications, and I'm really delighted today to be speaking with Susan Hannah, who's the Regional Manager of the NHS's Scotland Organ Donation Services team. Many thanks for joining us today.
Thank you very much for the invite. It's nice to meet with you and to discuss organ donation in Scotland and the changes that will be happening.
Before we go into detail and I ask you some questions about the new law, I wondered if you could just start by telling us a little bit about yourself and about the work that you do.
Yes, certainly. So my background is nursing and predominantly intensive care nursing. And then subsequently I became interested in the subject of organ donation and joined the service more than 10 years ago. And I'm now the regional manager in Scotland and support the specialist nurses operationally with taking forward organ donation in Scotland.
Great, thanks so much. So we've had a lot of questions sent in by Alliance members, so let's just get going. And I suppose the first and the biggest one really is, what does this change in the law mean for people and their families?
Well, Scotland is moving to an opt-out system for organ and tissue donation to help save and improve lives. This means that you will be considered to have agreed to be a donor when you die, unless you have chosen to opt out. By not opting out of donation, this is no less of a gift than an organ donated under an opt-in system. Donation remains very much a personal choice, and the new law does not change that. Family and friends will always be consulted on your views, and that is why having that conversation with them is very important for everyone to have. Whatever you decide, it's important to make your choice so that the family can understand, respect and honour what you would have wanted.
And when does the new law come into effect?
The law will be implemented on the 26th of March of this year. It follows the introduction of similar legislation recently introduced in England last year and previously in Wales several years ago.
And why was the decision taken to change the law?
Well, despite significant progress over the last decade, there are still around more than 500 people waiting for a transplant at any time in Scotland. Awareness raising and campaign efforts by transplant recipients and donor families in Scotland over the years has helped drive the shift in public awareness for organ donation. The Scottish Government has consulted on ways to increase donation, and one of these is including moving to an opt-out system. Following considerable support of the proposal for this legislation, it was introduced and passed in June 2019, and it will be implemented on March the 26th of this year. One of the most common reasons for family declines is not knowing what their loved one would have wanted, and this new law may make it easier to better reflect public opinion and prompt everyone to register their decision on the ODR, and to please share that with your family and friends.
So we know that there are some population groups in Scotland who might be further away from information about their rights. For example, people with learning disabilities, people for whom English isn't their first language, and people who have not so good access to the internet. So what action and marketing is being done to make sure that those population groups have got equal access to information about their rights?
This is very important, and from next week, on January the 18th, a national public information campaign will be launched to make people aware of their rights, as you have asked. And as part of this, in February, every household in Scotland will be sent a leaflet informing people of their choices under the new law. Also, been working closely with different communities and young people to make sure everyone in Scotland has access to information on organ donation. The leaflet will actually be transplanted into over 20 different languages with easy read and large print and audio to try and reach as many different communities as possible and seek their advice as well. how best to reach those who may not have some of these digital accesses and that you've spoke about there.
Thanks very much for that clarification. So it certainly sounds as if a lot of efforts are being made to make sure that the information is spread far and wide, and certainly the Alliance has been sharing information about the forthcoming change in the law on our website and using our social media channels too. I just want to get into a bit more detail about some of the nitty-gritty for this based on the questions that we've had in from Alliance members. One of those is a scenario where, for example, say a person's family member passes away sadly, but that person hadn't opted out before doing so, and the relative doesn't want their organs to be donated. What will happen then?
If a person dies in circumstances in which they could donate and they haven't opted out of donation, under the new law, it can be considered that they are willing to donate. There are, however, checks built into the new law, which means family and friends will always be asked about their loved one's views to ensure that donation does not happen if this is not what their loved one would have wanted. Sometimes for families there may be misconceptions and a lack of understanding that has influenced a family that they don't want donation going ahead. Our specialist nurses will always provide information where possible on the process and seek their advice and support for their loved one's decision rather than their own views about whether they want donation to happen. But if a family member remains opposed to donation, then it won't proceed.
Thanks very much for that clarification, and I certainly think that will probably help ease the minds of some of the members that have written in to us about this with questions. Another scenario that's been posed is, for example, if someone passes away but doesn't have any relatives or family and they didn't hear about the law change and therefore didn't actually physically take action to opt out, but their apparent wishes before passing away were that they would have opted out, would their organs be donated despite their intended wishes?
If you have not recorded a decision on the organ donor register and it's not possible to find any family or friends to discuss your views, then donation would not take place in these circumstances. What is most important is your view, and if this is something that you did not want, then the law will respect that.
Thanks very much again for that clarification. Now, you've already touched on this a little bit, I think, but could you maybe tell us a bit more detail about what the process is for opting out in Scotland?
The easiest way to record your decision, whatever that is, opt out or opt in, is the NHS organ donor register for both. It's a very quick process that will only take a few minutes, and whatever you decide, it's important to share with your family and friends as well, as it makes it easier for them to honour your choice. You can also change your mind at any time, and also your preference for what organs and tissues you want to donate at any time. And again, would ask that you share your choices and any changes with families and friends, because when you do speak to family at the worst time in their life, it does make it easier for them to know what you would have wanted.
And if somebody has, say, I've opted in, and actually I have to say I have already opted in, what happens if I change my mind later? Can I change my mind?
Yes, absolutely. You can go back on the organ donor register and update your details. And as I said, please tell your family. But yes, some people register and their views, and then many years later, for whatever reason, circumstances have changed for them and they want to change their mind, and that might be opt out or opt in, and that option is always there. For more information about the law change and some of the questions that you've asked, you will find that on the new organ donation website, or you can call the 0300 303 2094 number.
That's great. Thanks very much for clarifying that number as well. Now, another question that's come in for an Alliance member, obviously we're a membership with many members living with long-term health conditions, and someone's asked, you know, if they have a pre-existing medical condition, should they opt out?
We would advise not so, as having an illness or a medical condition doesn't necessarily prevent a person becoming an organ donor. donation of organs and indeed tissues will always carry some degree of risk, and that must be balanced against the benefits of transplantation, as well as the risks of waiting for a further offer of a donor organ. Medicines and treatments, they're always improving, and the decisions about suitability of organs and tissues is made by the medical professionals at the time of donation, and it will take into account your travel, your social history, as well as your medical details, but there are very few conditions that would rule you out to be an organ donor.
And what about if someone's happy to have some but not all of their organs donated? What should they do then?
That's a really good question, and again, you register your details on the organ donor register, and you are able to choose what you would be willing to donate, and you can specify what organs and tissues and what you would want to restrict. And again, if you wanted to change your mind on that, you can go back and do it, but you can be very specific about what you want to happen.
You've already touched on this a little bit, I think, but just to clarify as well, some people for religious reasons and for religious beliefs, again, may not have actively opted out, but will their religious beliefs be taken into account?
Yes, that is very important, and you can record your faith and beliefs on the NHS organ donor register, and this will be discussed as part of the donor conversation that we will have with your family. The specialist nurses will always ask about your views to ensure what you would have wanted can happen, and it only goes ahead when it is in line with your faith or beliefs that you have recorded.
Well, thanks so much, Susan, for clarifying all those points. Before we finish up, is there anything else that we haven't covered that you'd like people to know about?
Just to further emphasise the point that no one is automatically entered onto the organ donor register, and there is no deadline date for doing that. There is plenty of time to make your choices and your decisions known, and I would just urge everyone to have that conversation and to do so when the time is right for them.
Well, thanks very much for making time to speak to us today, Susan. Thank you.
Thank you.